students and all joining us for this special event. A warm welcome to the ceremony event of our talented students who have completed their internship at the Johns University and part of the medical education for the future, such as the MED program 2022. So today we are privileged to have among us very esteemed guests who have been the driving force behind this successful initiative. So please join me to welcome Professor န့anDate, the President of Country University of Washington. His leadership and visionaries has paved the way for many collaborations in the projects. So we are very honored to have you today. And second, I would like to introduce from UMP Professor Ngoc, the Managing Vice He strong support of the project, and thank you for joining us today, Professor Da. Yes, and I would like to introduce from UMP Professor Đặng Văn Hỏi, the Dean of Basic Science Faculties. From Yonsei University, please join me to welcome Professor Minh Lee, the Director of the Math Office in Vietnam. Professor Lee have a strong commitment, has bridged to great institutions together, fostering learning and mutual growth for the both institutions. And we are very honored to welcome Professor In Hong Choi, the Chair Duong Distinguished Professor from Yonsei University Health System. She conveyed or not attend today, but she sent her congratulation remark through video. And without further ado, first I would like to invite to come to the stage Professor Ngoc, the Managing Vice President of the UMP. He will share his congratulatory remark and insight. So, Professor Da, please.
Dear Professor န့anDate, Professor Lee, and Professor Choi In Hong is in online. Dear our professor and the candidate of MEF joining us today. So good morning, and today's we gather to celebrate the accomplishment of 7 exceptional candidates who have completed the medical education for future 2022, MEF 2022 for short, internship at the Yonsei University. These bright individuals were carefully selected from 26 participants at the University of Medicine and Pharmacy at Ho Chi Minh City, Vietnam. Over the past 6 months, these candidates have displayed unwavering dedication and commitment to their medical education. They embrace the challenges of new environment in Yonsei University, and their work hard has paid off. I congratulate each of them on their well-deserved success. Notably, some candidates stood out for their outstanding performance during the internship, leading to an extension of their stay for an additional 3 months. This achievement reflects their exceptional talent and dedication. I want to express my gratitude to the faculty and the staff of both Yonsei University and UMP as well for their support and commitment to the international collaboration. Look ahead to the future. I am pleased to announce the MEF 2023 internship will welcome 9 new candidates. This program's success lies in its ability to foster knowledge exchange and culture understanding, create a positive impact in Vietnam and globally. To the incoming candidates, I encourage you to seize every opportunity during your internship. Embrace learning, forge connection, and brings back valuable experience to enrich medical practice in Vietnam. In conclusion, I congratulate MEF 2022's candidates once again for their outstanding achievements. Your journey has been inspiring, and I'm confident you will be continuous excel in your future endeavors. Thank you all for your dedication and hard working. Thank you very much again.
Thank you, Professor Dak, for your inspiring work. And to join our today event, I would like also introduce Professor Nguyễn Văn Chinh, the Dean of Nursing and Medical Technologies. So please give him a big applause. Yes, so next, I would like to invite Professor In Hong Choi. She will deliver her congratulatory remark. So please.
Good morning, web fellows, professors of UMP at Ho Chi Minh City, and distinguished guests. I am very glad to share the achievements of the 2022 web fellows, making this meeting more meaningful. Despite some initial challenges during the beginning of the first web fellowship program, we are confident that the overall accomplishments have exceeded expectations. This success is a result to the hard work and dedication of both web fellows and their mentor professors at Yonsei. The mentor professors of the 7 2022 web fellows expressed great satisfaction with web fellows' passion and excellence. Web fellows' achievements will definitely have a positive impact on the future web fellowship program. Of course, Yonsei University has also gained valuable insights from the web fellows beyond what they have experienced and learned at Yonsei. Therefore, based on their experiences at Yonsei, I am asking the web fellows to contribute to the establishment of the current information on clinical field as well as basic research at UMP at Ho Chi Minh City and to continue collaboration with Yonsei. I believe that my fellows will make significant contributions to their institution by showing their capabilities to the full extent. Lastly, I would like to express my gratitude to Professor Lee, Professor Dang, and the MEF officer staffs for their preparations for this outcome sharing meeting. Thank you very much.
Thank you, Professor In Hong Choice, for your congratulation remark. So next, congratulate the such big achievement from our young talented student. It's time we celebrate the success. So now with the utmost honors, I would like again to invite Professor Dark. We come to the stage and we'll giving congratulatory flower to our successful talented student. And together with Professor Duong and Professor Minh Lee. So please come to the stage and please join me to give the big blossom to our 7-star today. And I would like to invite to the stage first Miss Nguyễn Thị Xuân Dieu, Faculty of Pharmacies. I would like to invite Miss Nguyễn Hoang, Tuyet Minh, Faculties of Nursing and Medical Technologies, and Mr. Huynh Công Bằng, Faculties of Medicines. Please join me to welcome Miss Pham Đỗ, Faculties of Medicine. So please come to the stage. And Miss Duong Ngoc, Faculty of Medicine. For the other 3-star, they have joined us online, and therefore they will receive the present later. Today we have 4-star, the brightest star in the stage. So everyone, please give the big applause. Blossom. Yeah. Now we have a photo, a memorable photo. So please smile to the fullest. Yeah. Okay, thank you on the English professor and so we now come to the next part of our event. So we already listened to the inspiring speech of our professor, and now it's time we hear from candidate, the successful student in the MEF 2022 program. They will share their outcome. They will share their experiences during the 6 months when they do internship in the Yonsei University. And I believe that that's very interesting story to listen. So first, we will listen to the first presenter, Mr. Nguyễn Minh Hà, Faculties of Pharmacy. She one of the very big successful for the program, because due to his great achievement, the program decided to extend for 3 months for his internship to finish up 2 papers. So he a big model for our student. So please, Miss Hà, please.
Em xin kính chào quý thầy cô và quý vị đại biểu. 안녕하세요. As I was informed, our esteemed guests this morning are both from Yonsei University and UMP. So for ease of communication, I will present my talk in English. First, I would like to say thank you on the behalf of the MEF Fellows to all of you. We are really happy to talk about our research topics. So my research is from the field of pharmacoepidemiological study. So for those who are not very familiar with this field, we are trying to gain insight of medication using large database over a long period of time. So we are talking about millions of patients and over 10 years following up. My topic is called benign prostatic hyperplasia medication and the risk of type 2 diabetes. It's quite a hot topic recently. So for the contents, I'm going to first give a brief background on why this study is quite a hot topic recently, and then we are going to present the results from our group and the implication it might have in practice and what I am doing now in South Korea. So for the background, so the two main medications for this study called finasteride and tamsulosin, they are on the top 100 most common used drugs worldwide, and their recent evidence had linked the use of finasteride with the increased risk of type 2 diabetes. Their first evidence in animal study, as you can see, it published in quite a prestigious journals, it's Diabetes from ADA. And there are a few small clinical trials that have been conducted, and the finding has been consistent that the use of finasteride or dutasteride increased the risk of type 2 diabetes. And then there are two big epidemiological studies that basically found contradicting results, which is quite interesting. And so there is a gap in research literature for us to investigate. So our study is to establish the incidence of poor glycemic control in type 2 diabetes patients using 5-alpha reductase inhibitors, which is the drug class for finasteride, by using both Korean and New Zealand database. So our strength is we have a lot of samples. In addition, our study is the first one who look at the effect of finasteride and tamsulosin in patients with type 2 diabetes. Meanwhile, the previous study that I just shown you, they look at the risk of develop type 2 diabetes in patients who do not have it. So this is the initial result from our study. This is quite a standard procedure in survival analysis called the Kaplan-Meier curve. And our result is quite unexpected. As you can see, the tamsulosin had a higher incidence of insulin restriction than finasteride, meaning contradict to previous results. The result here suggested that tamsulosin might be worse than finasteride on the risk of on glycemic control. So most of the research will stop here and they are happy enough to write a publication. However, we are aiming for publication in a high journals. So we apply a few more advanced statistical technique to check our result. So the advanced statistical technique we use called IBTW, inverse probability treatment weighting, in order to eliminate bias from our populations. And you can see the weighted hazard ratio here. The result is toward the new finding. It suggests that tamsulosin didn't worsen glycemic control more than finasteride. And just to be sure, we also carry out additional sensitivity analysis, and as you can see in this summarized, and you can see from the forest plot, plots here, all the result from the main analysis and additional sensitivity analysis toward the new values. So our results are quite strong. So what is the implication of this? We just finished writing a manuscript, and we at the moment we are sending it out to publication. We are suggesting that actually finasteride and tamsulosin maybe can both affect glycemic control to a certain degree, and the answer for which is the best drugs to prescribe for that type 2 diabetes patient with BPH is not clear. And that leads to the current topic that I am investigating with the Korean database. So on everything I presented to you was using New Zealand database, which have around a few 100,000 patients. But now, for the last month, I have been using Korean database with more than 10 million patients. So we are expecting to have the second publication within this year. And this is our picture that we of our department. We will now have a small dinners to celebrate the first publication, as you can say. And my supervisor is on the black T-shirt here. Her name is Professor Jalim Jo, and she has been an amazing supervisor to me. I want to say thank you to Professor Jalim Jo, and as well Professor Kim, Julie, and Anh Bang for supporting me through this project. So that's all for my research. I would be happy to answer questions that you might have, and thank you for listening. All the math fellows, I believe they will have exceptional things to say to you. Thank you for listening once again. Daro chu sasa kamsa turimita.
Thank you, Ha, for your very interesting presentation. And Ha is attending online. So if you have any question, we can have the second part with the Q&A later. So for today's event, we will have a series presentation about 7 presentations, and each allocated for 7 minutes. And then we come to the second part for Q&A. So now for the second presenters, I would like to invite come to stage Ms. Nguyen Thị Xuân Dieu, Faculty of Pharmacy. So please welcome her.
At Yonsei University, and our project focused on the development of nanobody for the treatment of psoriasis. As you may know, psoriasis is a chronic inflammatory autoimmune skin disease that affects millions of people worldwide, causing discomfort and distress to those affected. It's characterized by stress, dry patches of skin, and covered with scale, causing burning and itching sensation. The infected areas are the treatment options for psoriasis are diverse and range from topical medication, oral medication, light therapy to antibody-based therapies. Among these options, antibody-based therapies show the raised promise in improving treatment results, especially 3 specific antibodies named secukinumab, ecekizumab, brodalumab have been approved by the FDA for the treatment of psoriasis. And they work by targeting on specific proteins called interleukin-17A or its receptor, and effectively reducing the symptom and slowing down the disease progression. Our study focused on nanobodies, the tiny fragment antigen binding fragment from the camelid serum. These tiny structures possess unique features such as the compact dimension, remarkable stability, and powerful affinity for anti-aging. In similar terms, they are like microscopic superheroes with a special ability to target the root cause of psoriasis. So in this study, we aim to identify the romycin nanobodies targeting IL-17RA using an in vitro screening platform, and then verify and determine their sequence, and after that, evaluate their biological activity on several bioassays. The in vitro screening platform used in this study is based on the nature protocol, employing ribosome display, weight display, and ELISA technique, targeting the specific protein called IL-17RA. As a result, 4 nanobodies were identified to display the adherence to the IL-17RA. Therefore, they were verified and structure determined. So that I cannot show their full sequence because we intend to patent them if their bioactivity is excellent. So the purified nanobody were evaluated for their binding affinity by using ELISA experiment. As a result, 2 of them show significant binding affinity to IL-17RA, with the estimated EC50 value of approximately 0.1 nanomole per ml and 0.7 nanomole per ml, showcasing their effectiveness. the further evaluation of their bioactivity on reporter system and in vivo functional assay progress. So anyway, this research is exciting because it's so great promise in the possibility for antibody-based therapy in managing the psoriatic acid. Although I left Korea in May, so many things there is still here in my heart. And I will look back on those days with nice memories and gratitude. I will not forget my beautiful fiancé, my left, my professors, and my last night there, and even tears when we said goodbye. I would like to take this chance to express my heartfelt thanks to everyone involved in making this program possible, and to all of you for being here today. Thank you for your attention.
Thank you, Ms. Dieu, for your presentation. I see the last picture is the picture with tear, right? But I believe that a joyful tear, a happy tear during the 6 months, right? Congratulations, Ms. Dieu. And third presenter, I would like to introduce Ms. Nguyen Hoang, Dickman, Faculties of Nursing and Medical Technology. So please welcome her.
Good morning, ladies and gentlemen, esteemed professors, distinguished guests, and my fellows. It's my honor to stand in front of you to share the research from my fellowships. And my research is about development of a treatment for diabetic nephropathy using cholesterol metabolism modulators. This topic is particularly significant given the rising prevalence of diabetes and the impact of diabetic kidney disease in the patient lives. Before we move forward, let's have a look at the background and the rationale of the research. According to many studies, the chronic kidney disease, including diabetic kidney disease, accumulates the cholesterol in the kidney disease and worsen the disease by degrading the functions of the cells. However, there's no treatment that can target or remove the cholesterol from the kidney cells. Therefore, we would like to develop new treatment and confirm its efficacy by improving cholesterol metabolisms in the kidney cells model. This is the research schedule for my 6 months fellowships and the key activities. During the first 2 months, my primary focus was identification of cholesterol accumulation in the kidney cells by palmitic acid. And in the subsequent 2 months, I identified the cells and cholesterol mitochondrial damage caused by intracellular cholesterol accumulation. And in the last 2 months, I screened a number of indicators which related to cholesterol metabolisms. So how did I identify cholesterol accumulation in the kidney cell by palmitic acid? As you might know, the palmitic acid is the common saturated fatty acids, which have been linked to the metabolic disturbances, include the cholesterol metabolisms. So I cultured the a number of kidney cell lines with palmitic acids of the various concentrations, and we observe the increased level of palmitic acid cholesterol in the kidney cells. And after that, we further quantified and measure the viability of the two different kidney cell lines and choose the optimal concentration of palmitic acid. The initial findings set the next stage for the research, which I want to see the damage of the cell and the mitochondrial health by cholesterol accumulation. As you can see here, after exposure of palmitic acid, we found the increase of backs in expression and reduce of BCL2 in expressions, which promotes the cellular apoptosis. So these results prove that the cholesterol accumulation influence the cells and the mitochondrial health. In the last step of my research, I screened a number of genes which involved in the cholesterol metabolism. I'm not going to show all the detail of the gene expression, just a few here, and you can see some increase and some decrease. And now let's shift the focus to another aspect of my research about the mitochondrial DNA copy number determination. This is my own research, although it's not the current interest of Professor Yu Tae-hun's lab, but he was generous to order the reagents, so I could fulfill the experiment and solve the problem which I had in Vietnam. To generate the standard curve of nuclear DNA and mitochondrial DNA, we make zero of DNA templates and see the expression of reference gene, plotting the CT value against the logarithm of concentrations, and I generate two standard curves which have the good to see 95% and 105%. And lastly, I want to say that although I was dedicated to the research in the lab, I also try to maintain life outside the lab. And with professors and coordinator, we have chance to explore the beauty of soul. And this chance not only enrich my cultural experience, but also foster the collaboration and the connection. And I've really I found joy in the work and the environment where I live in. And I will really want to say thank you very much for giving me the valuable fellowship. 감사합니다.
감사합니다, Miss Treatment. You look so beautiful in the hanbok, the traditional costume. Yeah, it looked very happy and beautiful. So the next, I would like to invite Mr. Huynh Công Bằng, Faculty of Medicine. He quite interesting person. I his friend, and I follow his Facebook, and I see a lot of current picture during his segment internship. So today, apart from the research result, we also would like to listen more about your experience in Korea. So please.
Thank you, Professor, for my standing here. And now I will share some my reason and some experience in the Korean trip. This is my research paper, and we intend to publish in the in this year. This is the cost effectiveness of a universal screening program for Lynn syndrome in colorectal cancer patient at Vietnam. Yeah, this is my reasons of the Korean trip. This is one research paper and one training period at the endoscopy department of the Severan Hospital. And this is my background. I am second year of PhD program, and my major is biomedicine in the medicine faculty. My thesis is about the biomedicine and preventive medicine. I'm also a doctor at the endoscopy department at the campus 2 of University of Medical Center of Ho Chi Minh City. And my specialty is gastrointestinal endoscopy. I'm also married, and I have one son of 8 months. Yeah, and now I want to share some reason. My supervisor professor is Professor Kim Chan-su. He is the head of the Department of Preventive Medicine and outstanding professor in this field. I want to talk something about background of my research. 2 to 3% of all colorectal cancer cases are Lynn syndrome, the most common hereditary disorder. And Lynn syndrome, if someone have the Lynn syndrome, they have the early onset colorectal cancer with a high chance of recurrence. Also have the high risk of endometrial cancer and other extracolonic cancer. So if we can detect and manage the Lynn syndrome of colorectal cancer, we could reduce colorectal cancer incidence and mortality by around 70% in patients and their family member. And my question is, screening Lynn syndrome is appropriate for Vietnam situation and what strategy is suitable for Vietnam? And yeah, we build a model and some strategy to compare for comparison the strategy. And so this is the reason. Yeah, we can see that considering a treason of around around 11,000 US dollar per quality, the germline screening had a 100% probability of being cost effective compared to the no screening. And considering a treason of 11,000 US dollar, the IHC screening had a 60% of probability of being cost effective compared to no screening. So my conclusion is the Lynn syndrome screening with cascade testing of relative reason is effective with benefit in Ho Chi Minh City and in Vietnam healthcare system as a reasonable cost. And the universal germline testing is the most cost-effective strategy. And we need to close coordination of different stakeholders, such as primary care provider, specialists, genetic, clinical, and laboratory in research to encourage and educate the public about the importance of screening for Lynn syndrome. And to fully understand the Ho Chi Minh or Vietnam model, we need to have more study about to explore the other parameters sources that are now unavailable in Vietnam. Yeah, and this is yeah, like I say, I'm with Professor Kim Chan-su. Yeah. So I taught something about my training period. Professor Kim Chan-su lent me to Professor Lee San-kin. he is the head of the endoscopy department of the several hospital. So I came here to study about the early GI cancer diagnosis for some endoscopy therapeutic like endoscopic submucosal dissection and endoscopic ultrasound. And this is my and Professor Lee Sen-kin. We have meet again in a conference in Da Nang in the last July. Yeah, this is some connect between the Endoscopy Society of Vietnam and Korea. Yeah, and this on for me. Thank you.
Thank you, Mr. Bang. So you can see one of the benefits of the MAP program is apart from scientific activity, you will have also the chance to learn more about clinical training, like Dr. Bang have experiences. And next, very interesting presentation. I would like to introduce Ms. Pham Phuong Anh from Faculty of Medicine. So please.
Good morning, everyone. My name is Phuong Anh. I am studying master degree in hematology at the UMP. I feel so grateful to be selected as a participant in MAP Fellowship Program 2022, and it's such an honor for me to be here with all of you and share my experience in Korea. So thanks to MAP program that I had the opportunity to work under the guidance of Professor Liu Tan-tu. He is the president of Korean Society of Hematology, and he is also the chairman of Pediatric Hematology Oncology Department at Yonsei Cancer Center. Professor Liu is an expert in hematology, and clinical research in pediatric leukemia is one of his interests. So during my time in Korea, I had the opportunity to discuss with him about my research project, which focused on evaluation of treatment for pediatric acute myeloid leukemia. Our aim was to review the treatment outcomes of AML children treated with different regimens and evaluate the impact of the disease biological characteristics on the outcome. So under the professor mentorship, I was exposed to valuable insight into AML research from his department. Professor Liu guided me in handling the research data that I have collected from Vietnam and helped me shape the direction for my study. So the study was still in an early phase, and in order to conduct a more robust analysis, it is necessary to continue collecting data until a sufficient sample size is reached. So I am continuing my research in Vietnam now and anticipating to deliver a comprehensive and meaningful results. Besides, thanks to Professor Liu, that I have the opportunity to attend 2 international hematology conferences in Korea. And these conferences not only provided me with an updates in the field, but also allowed me to expand my professional network. I have to say, the most impressive and valuable experience for me was the clinical exposure during my time with Professor Liu and his team. For 6 months, I actively participated in daily patient rounding with the professors and residents. I also attended the professor's outpatient clinic almost every week. At the beginning, the language barrier was the biggest challenge to me, but the kindness of my mentors and colleagues who translated everything for me made it easier. And to overcome this challenge, I tried to learn some basic Korean medical phrases and use the translation application to navigate through the patient's medical profiles. Therefore, I can understand their condition better. So this clinical experience allowed me to expand my knowledge in pediatric hematology. I had the opportunity to witness the practice in Korea, and I also had a chance to see the advanced treatment for leukemia, such as hematopoietic stem cell transplantation and immunotherapy. These insights have been incredibly valuable for my own practice and provided me with deeper insights into the area that I am researching. And one more memorable moment for me is that I had the opportunity to present about pediatric leukemia at the pediatric roundabout at Yonsei College of Medicine. This experience meant a lot to me, not only as an honor, but also as a chance to showcase my interest, research area, and the Vietnamese medical practice to colleagues from different fields. So it was truly rewarding to witness the cross-cultural exchange between the medical workers of Korea and Vietnam. So in addition to my clinical experience, I had a wonderful opportunity to attend special events dedicated to the pediatric cancer children, including the mini sport festival and the Children's Day ceremony. So at the event, I was warmly welcomed by everyone, and it made me feel like a part of the team rather than a foreign doctor. I can see the dedication of the professors and the nurses in taking care of the children, not only about their physical condition, but also about their mental health. And I am truly impressed and inspired by this. So in conclusion, the Math Fellowship program has been an incredible journey of learning and growth to me. Working with Professor Liu has been an invaluable experience that has enriched my research and professional skills, and the exposure to international conference and the clinical experience also helped broaden my horizons and strengthened my dedication to the field of pediatric hematology. Finally, I would like to express my gratitude to the math project organizer for giving us this opportunity, and thank you for taking care of me and my team when we were in Korea. I hope both the University of Medicine in Ho Chi Minh City and Yonsei University will continue to thrive and grow further in the future. Thank you for your attention.
Thank you, Phuong Anh. Somehow through your picture and your smile, we can feel how joyful you are during the internship. So next, I would like to introduce Miss Ngoc, Faculty of Medicine. Please give her a big blossom.
Good morning, everyone. Good morning, professors. My name is Ngoc, and I am a PhD student in the Department of Pediatrics. Today, I'm very honored to be here to say something brief about my journey in Korea. I will say not very much about my work, but also my experience in Korea. Due to some accidents, I lost access to my Yonsei account because my password is expired. So I couldn't bring lots of images and pictures here, but I will try my best to give the most informed information about my journey so that everyone can have a look at what I did and how my 6 months in Korea happened. So first, I will introduce about the new techniques that I learned during my 6 months in Korea. And I have to say that although I'm very new to those new techniques, so basically when I arrived in Korea, I have to start my learning from zero. I have to learn a lot during my few weeks there, but everyone was very welcoming and they helped me a lot. And during those 6 months, I learned to, and now I'm confident that I can do those experiments by myself. I will start to do on the experiments with cell, including how to maintain cells, and on those experiments like seeding, transfection, and other works. And I learned to do Western blot, PCR, gene cloning, and how to create stable cell lines those are basic experiments to perform many different kind of research in the future. And using those techniques, at first I wanted to, my proposed joint research is related to my PhD research in Korea. The joint research couldn't be carried out, so I have to join with other people on other interesting research, and we are able to publish a paper during last month about SARS-CoV-2 infection and the way that this virus induced a different kind of cell death and damage to cells. Apart from the lab work, the people from the math office was very kind, and they helped me to perform on the papers required to attend in the clinical observation tour. And during my time there in Korea, I had a chance to visit 3 departments: the pediatric infection immunity department, the second one is the pediatric emergency medicine, and the last one in neonatal intensive care unit. And the doctor there, they are very welcoming, and they wanted to help me to learn a lot during my short time there. Like, I can ask any kind of question and they will take me around, show me how things work in that department, and let me join like many activities, including conference, seminars, and the morning round, and every other activities in the department. So I learned a lot during my 6 months there. Apart from the clinical observation tour, the lab work, the map office also arranged some extra activities for us. And we had one course. The topic is how to write scientific papers. And it is a 1-month course with lots of useful information for me. And the girls from the math office, they organized a trip to the Nami Island and Garden of Morning Camp. It is a well-known tourist attraction in Seoul, so that the fellowship from Vietnam, we can enjoy the cherry blossom. That is the purpose of the trip. And although that trip was very beautiful, I have to say that one of the most beautiful cherry blossom that I had a chance to witness is at Yonsei University itself. Yonsei University is very beautiful. The campus has lots of trees, and the cherry blossom there the scene was magnificent during spring. This is a timeline, a short timeline, so that everyone can have a look at my 6 months there. During first month, most of time was for the administrative papers, and then I have to learn basic lab techniques. After that, I joined the research works in the lab, and we learned how to write scientific papers. During my last 3 months, I have my clinical observation tour and the Koika trip in April to enjoy the cherry blossom with everyone. So that is on the works that I have joined during my time in Korea, and I want to take this chance to express my thank you to my professor in Vietnam to encourage me to join this fellowship, and professor in UMP for organized this fellowship for us, and my mentor professor in Yonsei, and on my co-workers and friends there, because my time there was very short and I'm new to those techniques. But I have to say that they want nothing else but to help me to learn and participate in their research work, their clinical works. I felt so welcoming to the point that I couldn't imagine, and I'm very thankful for that. This is the picture of me with everyone, and this is a very famous site in Yonsei University. At my last day there, my professor take everyone out for lunch, and then we go there to have a picture together for memory. So that's it. That is my brief presentation. Thank you for listening, and I hope that I can give you some useful information about my time there with Yonsei University.
Yes, thank you, Ngọc Mai. And last but not least, we come to present Mr. Minh Triet, faculties of medicine. So please welcome him.
Good morning, everybody. My name is Minh Triet. I'm currently a second-year resident from the Department of Dermatology at UMP. So today I'm going to share my experience during the last 6 months at Yonsei University. So my supervisor professor is Professor န့Date. So first of all, about my research with my professor. So we have been studying about the disease trees and psoriasis. So as you already know, psoriasis is one of the most common dermatology conditions, and among all of the immune cells related in the pathogenesis of psoriasis, the dendritic cells play an important role in driving T-cell mediated responses, and dendritic cells comprise many subpopulations. One of them is the disease tree subpopulation, whose function remain largely unknown till now. And one recent study shows that there was a significant increase in the CD163 positive disease tree subpopulation in the lupus patients, and it's significantly correlated with this SLE disease activity. And another disease tree subpopulations, another studies on disease tree subpopulation shows that there was an increase in of this subpopulation in psoriatic lesional skin. So the purpose of this study is we want to determine this correlation between the blood disease trees and psoriasis disease activity, and also we want to use the blood disease trees as an potential index in evaluation and follow-up of psoriasis patients in the future, if possible. And with this study results, we can further unravel the heterogeneity of disease tree subpopulations, and by that we pave the way for identification of this specific disease subset targeting therapies. So this is going to be we have conducted cross-sectional study, and there were about 30 patients divided into 3 groups based on the PASI score. PASI less than 5, PASI from 5 to 10, and PASI more than 10. And we're gonna assign each for each group 10 patients for each group, and the inclusion criteria are psoriasis patients more than 18 years old, and they agreed to join the study for, of course. And exclusion criteria are they hadn't used the topical steroid or immunomodulator in the previous 2 weeks before the study, or systemic immunosuppressants or phototherapy in 4 weeks before study. And they also excluded if they had bacterial viral infections or autoimmune diseases, inflammatory conditions, cardiovascular diseases, or end-stage renal diseases. All of the samples they were ready to use from Professor န့Date's lab. So this is my gating strategy, which is kind of complex to me at first. And the results to be honest, it's not quite impressive, but we can see that through rough analysis, we can see that there were not much correlation between the percentages of DC3 and the PASI score. So what I want to do next is to collect the samples from the healthy controls, and I expect that there's going to be an increase in terms of DC3 the population when we compare the psoriasis patients with the healthy controls. So this is my lab where I've got the opportunity to learn a lot from my researchers and my dear professors, Professor Kim Tae-kyun. So I've got a chance to study a lot of techniques required in the lab, namely flow cytometry, which I use in this study, and also I learned how to culture the cell and how to stimulate them to secrete the required cytokines, as well as intracellular staining for flow cytometry, and also I studied how to use ELISA, and so on. So that's a lot of techniques in 6 months, and it will absolutely be very useful for me in my future career as a researcher. And I was very, very happy and I feel very lucky to be one of the students of my professor, Professor Kim Tae-kyun, as he's very generous. And during the last 6 months, he has offered me a lot of opportunity to join many conferences in the field of dermatology. So first of all, that was Case ID 2023, an investigative dermatology conference, which was held at the Department of Dermatology at Yonsei University. And I also got a chance to go to Japan at Tokyo, and for the ISID 2023, and there I have got a chance to meet a lot of experts, like the best expert in the field of investigative dermatology, and got to know the idea of what's going on in the world and what's the trend now. Wow. So, and what we want to do next for the for the sake of the patients. And I also attended Korea Derma 2023, which is held in Seoul, Korea, and I've learned a lot from the experts in terms of cosmetic dermatology, which helps me a lot. Absolutely. And Professor Ki Yang-chung, he used to be the head of the Department of Dermatology at Yonsei University. He offered me the opportunity to attend the workshop of facial anatomy and reconstruction at Yonsei University, which was a hands-on workshop, and usually it costs more than $1,000, but I have been able to attend the class for free, so it was very lucky for me. And during the workshop, which lasts 3 days, and I have learned how to actually do hands-on training, actually do the thread lift and also filler injection under the ultrasound guidance. So this is a unique opportunity, as I was able to do it on the calipers, actually do it. And I did observership at Professor Kiam Chum's clinic. He was absolutely very talented person, and he's very skillful, and maybe one of the most skillful dermatology surgeon I have ever seen so far. He's an expert. He's an expert in most micrographic surgery. And I also went to Scar Center to be instructed by Professor Nguyen Lee. She's also very talented and very enthusiastic, and she was willing to answer any of my questions. And and the outdoor activity during the last 6 months, I've been working hard, so I didn't have much time for outdoor activity. But the Department of Dermatology, they were very generous, and they offered a free trip to Hoang Botanic Garden. And to be honest, I've been, it has been a really long time before I come back to the nature, and it was really great experience. So I would like to send my special thanks to Professor Jun Ki-yang, Professor Kim Tae-kyun, my supervisor Professor Lee Yong-in, and all of my researchers at Professor Kim Tae-kyun's lab. They are Park Chae-yun, Kim Sung-hee, Xie Li-hua, Lee Chu-hee, and Tong Sin-shi. Thank you for helping me during the last 6 months. So that's my brief presentation about my experience during the last 6 months. So thank you for your attention.
Thank you, Mr. Triet. And ladies and gentlemen, please give a big applause for all the presenters for sharing their value experiences. So now we open the floor for the question, the Q&A part. So if you have any questions, please raise your hand. So I see Professor Duong taking a very long note. I wonder if you want to start the Q&A session first, because you write a lot.
Thank you. I'm not raising questions to the presenters. I just have some notes about how can we do better for the fellowship program in the future. So and my impression about your experience. So maybe I will share later. This time is for Q&A session, right? Or yeah. So I will share later this one. Yeah. Okay. So please, is there anyone have a question for the researchers? You can raise the questions.
Yeah, thank you, Professor. Yeah, any questions, please? So, Professor Mingoli, yeah.
Okay, thank you for your presentation. It was most very impressive. And the last speaker, Dr. Triet, is there Dr. Triet there? Okay.
Yeah.
I enjoyed.
Professor.
Yeah, I enjoyed your presentation.
Yeah, thank you very much, Professor.
Yeah, you have many experience in dermatology department, but actually the flow cytometry, especially you did the flow cytometry, use the flow cytometry.
I'm sorry that the quality of the audio is quite it's not quite good, so I cannot hear you very clearly.
When you when you find out the dendritic cell 3 number GC3, at that time you use flow cytometry, and how many colors did you use?
For the flow cytometry panel, I used up to 13 or 14 colors. So I think that's not a very small number. And in addition, I also have a separate panel for intracellular staining and stimulation for cytokine production. So yeah, that's not included in my presentation, but yeah, before I left Korea, I did some first steps regarding cytokine stimulation. So yeah, cytokine production stimulation, and my peer researchers at Professor Kim's Taekwondo lab, they are expected to continue my research during their time there.
Yeah, but I think in Korea also there are not so many people who can manage the flow cytometry more than 10 colors. It is very hard, I think. But you are, I think, a pioneer of the flow cytometry. But actually, and the dendritic cell 3 is also, we do not know well, but you studied about that. And actually, it is not easy to find out and not easy to separate the DC3 is also, I think, a very hard topic. But during only for short 6 months, you have done the study, you have studied about dendritic cell DC3. Okay, but I think you could have many experience, not only in lab, but also in the clinical field also. Thank you for your experience.
Thank you very much, Professor, for the opportunity. Yeah.
Thank you.
I think, yeah.
Thank you, Mr. Triet. Yeah. And is there any more questions? Please raise your hands. So I have one question. Maybe any of you can answer. So what is your most valuable memory during your 6-month internship? Maybe I can ask Mr. Bak.
Thank you, Professor Dang, for the question. I think that I am very impressed with the scientific background of the Yonsei, because you know that it so have so many wet lab and dry lab. So because in Vietnam we don't have a lot study and research like that, and if we have a question, you should use many assumption or the data from another foreign country to support your question. But in Korea, because they have a lot of labs, so they have a lot of data and the assumption of the on-site, so it's very supportive to the research in Korea. Yeah.
Okay, thank you, Mr. Bak. And yes, please.
Good morning, Professor, and good morning, everyone. My name is Phuong. I'm a young lecturer of UMP, and I'm also candidate of fellowship MVF 2023, and I'm going to enter Korean in next month. So today I really want to have a question. I see that the minority of fellow of 2022 have a interesting result, and many of many have a papers or results, but I really want to know that when you begin to choose an idea, or how you can find an ideas for your paper, for your research. You have you to contact with the professor when you enter Korea, or before you enter Korea, to find the good idea, or how you carry out this research. You use the data of patent of Vietnam or patents, Korean patents. Before I enter Korean, I really worry about the outcome. So I really want to know more. Yes.
Okay, thank you. Ms. Ha so far already published one paper, and he submit another paper. So Ms. Ha, can you share your experiences? Mr. Ha, can you share your experiences? Can you hear us? Mr. Ha, Faculty of Pharmacy.
Okay. Sorry, yeah, I couldn't unmute myself. So thank you for your question. Good morning, everyone. Yeah, good morning. My research, I have been, conducting it for a year before I came here. So it's for the time frame, to be honest, you have to get an idea. Ideally, you got to get an idea before you came into Korea if you want to get a publication within 6 months, because 6 months is quite short. I don't know about your field, but for my field, then we have to apply to use the data, so the big database usually came from the government, and then as you know, the process to obtain the data can be quite lengthy. It usually takes more than 5 months. I was lucky; it took me 5.5 months, but it usually more than that. So yes, so about that, if you want publication, then probably you have to prepare your ideas before you came. And another thing is you have to consider how feasible it is for your idea to come into publications. It depends on your skill. So Chief, me and Chief, we are working on other publications. Chief is very talented in my opinion, but it's just the nature of the wet lab. It doesn't really produce result in a 6-month time frame. So you have to consider that if you are working working on a wet lab environment. So I hope that answered your questions. Is there anything else you would like me to clarify?
Yeah, do you have more question, or feel satisfied with the answer? And one information is, if you couldn't publish the paper, there is no punishment at all for the outcome. So please feel free. I mean, no more worry. Okay, Miss Yip, please.
So good morning. Actually, I plan to go to Korea, but the timeline is not suitable for me because the new academic year will start on September. So I would like to ask if you can extend the period of time study in the Korea Yonsei University from March to October. Is it okay? Or I would like to ask about the timeline, the period of time to go to the Korea. Could I apply for later for March until October? Is it okay? Or exactly it need to go there on this November, I think, right? September.
Okay, thank you, Miss Yip.
Yeah,
Professor Lee, please.
Yeah, thank you for your question. And actually, the timeline is not fixed, but every year and the next year, actually, we will start the 2024 fellowship recruitment will be started this September. Therefore, we cannot fix from March to September like that, but we will make our schedule according to our system, because we have to ask and we have to think how many UMP professors will stay in Korea. We have to think, and how we can manage the number, how many professors or the postgraduate students we can manage. We have to think. Therefore, the timeline may not be good for you, but we cannot think that everyone's the date. Therefore, we have to decide the time according to our situation. Sorry.
Okay, thank you, Professor Lee. And due to the short time of our event, so I would like to invite for the last question for Q&A. Yes, please.
Thank you very much, Dr. Ha, for your experience, for your sharing your experience for me about your research. So I have for Dr. Triet, I can see in your trip in Korea, you not only carry out really interesting research, but also you join in a clinical tour. So I really want to listen your experience to manage your time, because you have only 6 months and you do many work like clinical. And I and many candidates of this fellowship really want to improve my clinical capacity, also to carry out on research. So the time is really short. So I want you share your experience to manage your time. You divide 6 months into how many periods, or like that?
So, Mr. Triet, can you unmute yourself?
Okay.
Okay.
Yeah. Thank you for your question. That's an interesting one. So, in my case, I would consider myself as a researcher, like during on 6 months. So I try to make the most of my time at my professor's lab for sure. Yeah, because firstly, the purpose of this program is to improve our research capacity. So we have to concentrate more on researching. So in my case, I try to finish my work at the lab first, like during the first few months, and then in the last month, I asked my mentor professor, Professor Kim Tae-kun, if I could go on a clinical rotation, because as a doctor, I really want to improve my clinical skills and do some observership too. So luckily, my professor agreed, and he is a very generous person too. So he also offered me the opportunities to join many conferences during my time, last 6 months. So I think it mostly depends on your mentor professor. So if he's as generous as mine, so it would be great. You will have a lot of time for clinical rotations, but if not, I think you can expect that, and so try to work with your mentor professor, and you can contact him or her even before the program, so to make clear your intentions before the trip. Yeah. I hope that my answer can fulfill your questions. Thank you.
Yes, I'm sorry, Professor Lee. I just have to just share my impressions. So through your sharing your experience in South Korea in the last 6 months, I can see there's a lot of different topics in this group of our young researchers, from prostate to psoriasis and to Lynch syndrome and so on. The input is we have a variety of research topics. The second thing I can see is during your 6 months, you also have a lot of activities. Some really involved in research activities, some involved in clinical observation. And you also involved in different kind of courses like writing how to write paper, scientific papers. And also there's a lot of tour. So I'm sure you have a lot of experience in research, in clinical observation, in cultural exploration. So that's very nice. I think you are able to enrich your life experience a lot during your 6 months in Korea. That's very nice. And I can see the results also very different. Some have a very good. Some they already publish a paper, and even publish the second paper. Some are on the process to writing a paper, and some have clinical experience but not really reached to the level of writing a submitted paper. I think why we have these differences, I think we can share, we can do something to overview the difference here, and we can learn some kind of lesson for the next group of students. I mean, our next group of our researchers. So that's something that we would like to consider, saying how can we improve. But my impression of this, of all of this presentation is, I think I'm sure you learn a lot, and you enrich a lot about your life experience. That's definitely is very good. So congratulations to all of you. Yes, I know it also depends on a lot of the opportunity that coincident that may happen during your time with your lab, with your supervisor in the lab, because I can see some one or two our young researchers also have a chance to participate in international conference. Maybe because that coincides with that conference, so they can. I am sure the supervisor will support you to join the international conference if there is international conference at that period. So that's very good thing that I think our researcher have experienced during the 6 month periods. So my suggestion is it possible that we should do a survey for all of these, I mean, section 3 done. We can do a survey from what they learn, what you would like to share with the second group of our researchers, your colleagues. And then from that survey, we can share and we can meet our second group researcher before they leave for Korea. We can talk to them, and I think if we well prepare, the result will be better. My mindset is always doing something better. I think I would say you already have a very good experience. I think you learn a lot, but we still can do better. So that's my mindset. it doesn't mean that you don't. I would like to say that you learn a lot. You do a lot of things, and excellent. I think you have an excellent work during the last 6 months. But we, by doing something to learn from lesson that we learned from you, we can do better for the second batch. So that's my I would like to say. So again, congratulations to all of you. So thank you.
I agree. Your opinion. It is very important to share your experience. Therefore, we prepare this sharing meeting. Because after coming back, the first 2022 MEF Fellows, your experience is not only yours. We hope that your experience will be shared to the members of the UMP, the other members of UMP. Therefore, I discussed with Dr. Tang to prepare this kind of outcome sharing meeting. Therefore, not only 22 MEF Fellowship program, but also 2023 MEF Fellows. I think you can learn more also. But however, this morning, I think I'm very happy to hear your presentation. I think the product is more what I expected. You asked, Professor Duong, you asked, what is the difference? Someone have already paper, but the other someone do not have the paper, but what's the difference? I think there are many differences. The first thing is the PI at Yonsei is very important. But actually, when we look for the PI at Yonsei, we think several things. But actually, it is not easy to accept the fellows, only 6 months. When I apply to United States, when we say, I will go to your lab for 1 year, usually the professor in the United States, they do not accept. At least 2 years. Then that means if the PI accept some students or the young researchers, postgraduate students, they think they want to get some benefit. But if you stay only 1 year or less than 1 year, they do not get anything, usually. Usually the person are not helpful to their lab. Therefore, they want the person from foreign country to stay at least 2 years. Most people, they want to expect 2 years. Therefore, when we decide only 6 months to show. Therefore, we wanted to extend one more term. There is here at the first 21 fellows among, only one person can extend 6 months more. But as I told you, I think the product, what you have produced, is more what I expected. Only 6 months you made some paper and you attended some international meeting also. Therefore, I think and I hope, and the 2023 MEF Fellows also, you can get at least 2022 MEF Fellow, like 2022 MEF Fellows. Therefore, I think that is good experience. That could be a good experience to all of you. But as I told you, when I heard your presentation, at first I am very happy to hear because your product is very excellent, even 6 months. And I'm also to say to thank to Professor of the Yonsei PI. They are also their attitude. I think their attitude is very good to open to work with you. Therefore, you can have more product during a short time. And I hope that in you, not only 22 MEF Fellows, but also 23 MEP fellows. I think, especially 2020, you are the first MEP fellows, 7 members, but we expect for 5 years, 36 members. But this year, maybe 2023, 11, and I think 9 members will go to the Yonsei University as the 2023 MEP fellows, and the 3 more members from Faculty of Medicine. Therefore, 12 more members will go to Yonsei University this year. But we will recruit the 2024 MEP fellows, maybe I think we think in September or this year, we will start. Therefore, we hope that the purpose, as you know, the purpose of this program is to increase research capability of UMP. But as you heard, as we heard, some of you have the clinical experience also. Therefore, how have you, many people are asking, how can I get the clinical experience also through this project? You can ask to your PI at Yonsei. And if your PI agree to you and he can manage, he can connect to the clinical field also. And 2022 MEP fellows, I recommend you, please continue the relationship between you and your PI at Yonsei. And I think it could be helpful for your, in the future research, or not only research, but also your clinical field, also your activity. It could be very helpful. Actually, I studied in United States for 2 years, and after coming back, I could meet the doctors who working there. Most of them are dermatologists. Therefore, I could meet them in every international dermatology meeting. In every international dermatology meeting, I could meet them and I could share our knowledge together. Therefore, until now, I have relationship. Many of them, I have relation with them. That is very helpful to my career also, academic career. Therefore, not only 22 MEP fellows, but also 23 MEP fellows. If you will go to the Yonsei University, please continue your relationship with the Yonsei PI. And as I told you several times, I'm very happy to hear that all of you have a good memory, not only Yonsei University, but also Korea. That is, thank you very much. And thank you for your coming here today's outcome sharing meeting. Thank you.
Thank you, Professor Lee, for your very good advice. With that, we want to conclude this event, and we are expecting more and many more outcomes, many more collaborations, and future prize on the MEP fellow in the near future. So I want to wish all of you a good day, full of energy, choice, and have a good lunch. Thank you. And now, please, all of us come to the stage and have a group photo together. So please.
Ngồi đi, ngồi ông Nhân. Nghĩ gì ngồi đi. Đứng như này cũng được. Nói với lại dài dài thì đứng như này đứng được dài. Ngồi đi. Rồi.
Bạn cứ thích lên luôn đi. Lên luôn. So, đi come to the stage. Yeah, all of us.
Everyone.
Yeah. Thank you for the nice today. Qua đây này, tôi cho nó đi xuống. Okay.